How long do dental fillings last? Dental fillings are an everyday dental procedure that is used to fix teeth that have been affected by injury or decay. They're typically constructed out of amalgams, composite resins, porcelain, or gold. They have been designed to mimic appearance and functions of the natural tooth. The most frequent question patients ask about dental fillings and how long they're likely to last. The lifespan of a filling for a tooth is contingent on a number of variables, including the materials used, the area of the filling, the dental hygiene practices of the patient, and the root cause of any issues, including grinding or bruxism, teeth grind. Amalgam fillings are comprised of different metals like silver, mercury, tin, as well as copper are well known for their longevity and durability. The average of amalgam fillings will last between 10 and 15 years. However, some could last for longer if they are properly maintained. Composite resin fillings, in contrast, consist of an enamel-colored plastic and glass-based mixture. While they're visually attractive than amalgam fillings, they're generally less long-lasting. Composite resin fillings will last 5 to 7 years. However, they can last longer or less depending on the dimension and position where the resin filling will be placed. Gold fillings can be another choice that has been praised for their long-lasting nature. Gold is a sturdy substance that will last 15 years or more provided it is treated properly. Gold fillings, however, are much more costly than the alternatives and might not be more appealing visually. Porcelain fillings, are also known as omlays or inlays, are another option with a long-lasting durability. They could last for at least 10 years. Porcelain fillings can be custom designed at a dental lab. They bond to teeth, thus making them sturdy and durable. As well as the substance that is used, the position of the filling could also influence its lifespan. Fillings that are placed in regions of the mouth which experience significant pressure due to chewing, for example molars, can break down quicker than fillings placed in more relaxed places. People grinding or crushing their teeth might be experiencing a decrease in the lifespan of their fillings. A constant force and friction may make the filling wear down or break quicker. Maintaining a healthy oral environment is vital in extending the lifespan of a filling. Cleaning and brushing your teeth regularly will assist in the prevention of gum disease that can cause damage to the filling. Regular dental cleanings and checkups can also help in identifying any problems with the filling at an early stage. In certain instances, it is possible for a filling be replaced earlier than you anticipated because of factors like cracks, decay, or wear. If a tooth filling becomes fragile or damaged, it's important to consult the dentist as soon as is possible in order to stop more damage of the tooth. In general, the lifespan of a filling in the mouth is dependent upon the filling material chosen as well as the place of the filling and oral hygiene routines and other particular elements. When choosing a strong material as well as practicing proper oral hygiene as well as visiting the dentist frequently, patients will aid in ensuring that the fillings in their mouths last longer than they could.